to the cloud. So, hi Ashish, welcome to the Demo Big Unlock podcast. I am Rohit Mahajan and I'm the CEO and managing partner at Demo Consulting. It is fantastic for us to have you once again on this podcast after a long while. So, I'm sure things have come a long way. So, would you like to please start with your introduction?
Happy to, Rohit. It's always a pleasure to talk to you, be on the podcast here. I'm Ashish Atreja. I'm a physician executive here at UC Davis Health. I'm also a venture partner at GlobalVenturesX with a mission to create have clinicians as co-creators and co-founders for mission-driven initiatives in that regard. I have been in the role of Chief Innovation Officer in Medicine at Mount Sinai. And before that, I was informaticist at Cleveland Clinic. I still practice gastroenterology one day in a
Awesome.
week at UC Davis Health, and had worked as a CIO and Chief Digital Health Officer at UC Davis Health, supporting transformations at scale.
That's awesome, Ashish, that you are able to pack so much into one day. Could you please share with us, like, what motivated you on this journey? How did it all start, and how have you been navigating so far, and where you are headed? I think you have a very interesting, group which is Valid AI. So perhaps talk about that as well.
Yeah, absolutely, Rohit. I consider this as my fifth career life. Very lucky. Starting off as a physician and a public health scholar, uh, and then really my first day of my residency at Cleveland Clinic, I saw a lung transplant patient. But that was the time when lung transplant was just getting into practice, and
Oh,
the books I used to read did not mention how to take care of a lung transplant patient. So there was no knowledge in the book because it takes 5 years for the knowledge to go into printed books at that time. I'm talking about 99,
wow.
2000. So someone told me, look at Up to Date, which was the first good online textbook. And I managed my first patient learning from an online textbook. And after I managed the patient successfully, a spark idea came to me. Wow, it was just a database, but technology made it so easy for knowledge to flow. And this is something that has never been taught to us in our medical school. So I
Hmm.
could just see in 99, 2000 convergence of how much technology can enable us. So that's led me to be on informatics and IT. So I did informatics fellowship at Cleveland Clinic, supported inpatient Epic implementation, and then started the journey in innovation. And that was my second life on moving beyond informatics to innovation at Mount Sinai, and then transformation at scale at UC Davis Health. So over the last 20, 25 years, I've been initially 50% to now close to 100% in IT, digital health, and AI now. With the same mission, how can we leverage technology to make us better physicians, better clinicians, better scientists, leveraging that?
That's awesome. So you did mention AI, Ashish, and you have a very big initiative around AI with the Valid AI. So could you explain us, like, what motivated you, what is it all about, and which direction it is heading in?
Yeah, absolutely. Love to. I think previously when I was doing digital health, we were setting up one of the first digital health lab in the country at Mount Sinai. We felt the need to have an evidence-based way of looking at digital health applications. So that time I had started Node Health, a network of digital evidence in health, a nonprofit that brought health systems together how to independently look at digital health applications. I felt the same need in the age of AI and especially generative AI. There is so much solutions coming down the pipe, so many algorithms, so many products. How do we even evaluate? How do we bring it to our equation? How do we create value from it? And we can still, in our health system, work on them, but we are basically repeating each other work. If I am
Mhm.
evaluating the solutions, the other UC is doing the same thing across the coast. Someone is doing it. We do not have that much bandwidth in our health system to duplicate all the efforts. So Valid AI came with the effort that, hey, we need to come together to learn together, to do things together, and create efficiency. So this program got blessed by USCOP, UC Office of President. And then we launched at Health around a year, 2 months ago. And we initially had most of the states in US represented. Around 38 to 40 health systems joined the network and health plans. And we meet bi-weekly, ranging from maturity level to governance, to what are the high impact use cases, to what are the monitoring we need to do. So how do we health systems learn from each other and really make a very efficient way of transforming ourselves? As we are heading to year two, uh, VALID in briefly stands for Vision, Alignment, Learning, VAL. That was our goal for the first year. And then implementation and dissemination of science.
Nice.
Those are our year two goals. So as I'm getting feedback, we have now grown to 54 organizations. We are thinking heavily, how do we help implementation at scale for not just to valid AI founding partners, but actually outside that as well, extending the benefit of valid AI to anyone, but also make AI affordable, accessible to everyone. So we're putting things together to create shared teams, which can really empower the entire healthcare ecosystem. And it's a very fascinating kind of a next step ahead for us.
That's awesome to know. I never knew the full form, like you just described, of valid and in such a nice manner, Ashish. So it's an ocean out there, as you just described, and you know, uh, tens, if not hundreds, of health systems are on this AI journey. So, with such a large landscape, how do you make meaningful transformation happen? And what are some of the capabilities that you might try to build around that?
Yeah, great question. I look at the landscape of external landscape and then internal to the organization landscape. I do feel there is so much potential to create efficiency in healthcare stream that we need a network of organizations. So I look very closely, and I'm a part of the working group for Gen AI for CHAI, Coalition of Healthcare AI. So we need to look at FDA and the governance from the federal government, but then we need something like CHAI to kind of create frameworks and uh, guidance back in that regard. But then we also need something like Train, which I'm part of as well, from UC Davis Health, which looks at the Train network, looks at how do we kind of really distill things to more infrastructure level and kind of monitor that in a safe manner. Where Valid AI positions is more on impact. How do we follow the guidelines from CHAI and the federal government, but how do we actually bring it to reduce to practice is what we call rubber meets the road and really create an impact so it really has a return on investment for us in that regard. So that's the learning part. But when we look at how do we really create an impact within our organization, moving from, and I had a great discussion with some of the folks, and I was saying all these external network organizations actually are interdependent and support each other. For example, if we implement something and give feedback to Chai to, hey, your open model card really is working and this is how we're using it, that supports Chai mission as well. So we came with the concept of this Olympic rings, 7 Olympic rings or 5 Olympic rings,
Mhm.
which are
Yes,
interconnected. So
yes.
we need interconnected different organizations outside to support us from that. But when we look at the landscape for internal to an organization, let's say UC Davis Health as an example, where I've been leading the charge on transformation, digital health and AI for the last 4 years, we need to look at our AI strategy or our overall health system strategy. Is our focus being in a quaternary hospital? Do we want to expand geographically through care at home? What are the major things we as an organization want to achieve? Because that major strategy then governs how we put AI into it, right?
That's
So
true.
it starts with a strategy first approach, and then we distill from strategy to governance, which means how do we bring AI, which all approvals we have to need. We need cybersecurity team to look at it. We need approvals from ethics and equity compliance kind of committees, whatever structure are there. We need to look at someone from procurement, how they procure in that regard, whether it's in UC with. So we need to have some governance structure, which not only helps us move this along, but also the governance structure also helps us prioritize. because there are so many possibilities right now. We can and we should not in any way bring all the AI technologies. We cannot and should not do that. We need to look at out of all those technologies, which is completely aligned with our strategy that meets our gaps. So strategic lens. And then using the strategy lens, prioritize the top 5 or 10. Then those top 5 or 10 then go through the governance and the implementation and the procurement process. Once the procurement process happens, then we call it AI adoption roadmap needs to come in, where
Hmm.
we have project manager, project coordinators, integration experts after the procurement actually putting it together. Then the go live happens. And then we also need to do evaluation at scale and
Hmm.
monitoring at scale. We need to measure that
Right.
the algorithm doesn't degrade. We also need to know that we are creating an outcome which we want. Many
Right.
times we are guilty of taking a new technology, just implementing it and not measuring its impact and not
Right.
monitoring it. So I think there's a new, we call it implementation science layer that
Yeah.
has to be built in. We published a paper in New England Journal of Medicine AI that the need for creating AI implementation science centers in health system.
Very interesting.
And right. And I'm a gastroenterologist, so I often crack the joke. The food is there, but our stomach has to be empty enough and there has to be hunger so we can
Yeah.
ingest the food. Once we
Yeah.
ingest the food, then we can digest the food,
Right.
right? So we need to increase our capacity as health
Yeah.
systems to be able to ingest the right kind of AI
Yes.
solutions and then to be able to digest and create the maximum value from those AI
Yes.
solutions.
That's awesome. So, Ashish, since you have been involved with AI and now Gen AI for some time, could you narrate any use cases that you might have, been involved with yourselves or people that you know have done successfully? What are some of the things on the landscape that are making it into the health system, and what is some of the future directions that you see over there as well?
Yeah, happy to. So when we started doing research work with Valid AI, we are looking at every single publication, preprint or major journal publication that's coming for use case. So we're setting up a use case library of 165 use cases. And
Nice.
the domains we are finding are either on the employee and physician productivity. So we
Mm-hmm.
are seeing like AI scribe is perfect in that space on physician productivity, but we're also seeing emergence of tools which will cater to all employees of the healthcare worker, not just the
Right.
clinical workforce. And we are kind of looking at those possibilities. Then we're also looking things at the patient automation side. Can we
Mm-hmm.
bring generative AI solutions which can guide the patients wherever they are? Because we have an access problem. And it's not easy just to pick up a phone and talk to anyone in health system, but get some of the routine work be done by generative AI solutions and guide the patients automated or semi-automated with humans in the loop sometime. Then we're also seeing operational efficiency solutions like RCM and those which can allow better
Yeah.
and enhanced capture. So we're seeing kind of a three-legged kind of approach to that.
Right.
And we are using a PRISM kind of a method from Gartner, which looks at feasibility as well as time.
Yeah.
And we are putting a next layer is impact. So you look the lens
Yes.
from whatever is feasible today, and the time to onboard that is not much, and it creates a maximum impact that can help you prioritize the most relevant use cases. In fact,
That's
because it's not about bringing AI, it's about solving what problem.
yes.
And then you find the relevant things, AI or non-AI, to
Right.
be able to do that. So part of us is also educating our executives and leaders to start with a design thinking approach, of problem first approach, of a
Right.
strategy first approach. And that's something our phase two of Valid AI looks like, where we create kind of a way to align everyone around strategy and problem first approach. Then the most meaningful, impactful use cases that come. And then we are able to measure the impact. So few cases that we already have implemented. One is AI Scribe, and I was talking 2 years ago. It's gonna be like water. Everyone is gonna be using AI Scribe
Yes.
because, and this is the first time, Rohit, I have seen the chairmans kind of arguing with each other who should go first.
Wow.
You know,
Yeah.
technology typically has a productivity paradox when it comes to
Yes.
healthcare. Every industry has benefited with productivity except us in healthcare.
Yes.
But I do feel finally the time is here when we unlock the productivity paradox with technology for healthcare, with generative AI, and AI Scribe is a perfect example of that.
Right.
So we implemented in pilot phase, and we just got ravishing reviews, including physicians just writing that this is the best technology they have seen till date. And this is a physician who's
Awesome.
about to retire,
Right.
right? We didn't have to train them. We've also brought technologies in vision AI, something like AI Doc, where we were able to find that more PEs can be detected at
Right.
an earlier time. So we fast
Right.
track that implementation as a platform. So we have 7 sectors in AI from a strategic lens at UC
Hmm.
Davis Health. So we've been able to bring applications from risk prediction, like sepsis algorithms built in LA, then we fine tune that to things which can predict how the person is gonna go worse based on alerts coming from wearable sensors.
Hmm.
Uh,
Right.
to to vision AI, computer vision technologies. To technologies like generative AI from AI Scribe, but also then looking at and understanding generative AI. Can we unleash it to all the employees, bring the policies and other together to make every employee more powerful and impactful?
That's awesome. So Ashish, it was really nice meeting you at JPM, a few days ago actually in sunny San Francisco this time. And I was at your launch. Would love to learn more about what you talked about at the launch on the venture partnership and the kind of startups that are coming through the venture studio. Could you share us some more
Yes,
information about that?
yes, Rohit, happy to.
Yeah.
I think throughout this informatics and innovation journey, I was lucky to be part of a spin-out from Mount Sinai, which took our app prescribing platform. We were the first one where doctors could finally prescribe apps in addition to medicine and surgery. And that got patented and had a Nuco launched a startup. And I was, very grateful to be at the board to see the VC-backed company finally getting acquired last year after touching 30 million lives directly and 60 million through United Healthcare. So total
Wow.
90 million lives touched.
That's great.
As I looked back on the journey, especially in the age of AI, I feel we we can have a better way of partnering or creating startups in partnership with health systems and health plans. Um, Maybe embedding our soul. I look at startups as raising a kid. You have to put your heart and soul into it. And initially, their capacity is they need to learn how to poop, they need to wear diapers, but then they build their capabilities, and that takes time. And you need to be patient during that process, nurture them. So part was, especially with the generative AI, how can we create an ecosystem where we learn as healthcare organizations how to better partner with startups? Maybe those startups are co-created by different health systems and health plan. That led to the concept of GVX, Global Venture Accelerator, where we are creating soulful startups, but in partnership with healthcare organization. So they are not outside created by someone and then trying to disrupt you inside. They are actually from the very beginning supporting inside out transformation, right? Because their soul is
Yeah.
actually from clinicians as co-founders, health system led initiative. So was very happy to see that launched at JPM, and we also launched along with that our first startup called Fusion Care, which
Yeah.
is planning to support health systems and health plans and individual practices in obesity centers for excellence with the GLP-1. I do feel the biggest trends we have seen in the last few years for us have been one is obesity and metabolic syndrome, which I, as a gastroenterologist, never felt can be treated by a physician except than bariatric surgery. Now, the biggest disease we have of modern civilization can now be treated with medicine.
Yeah.
But there's many more things that have to come together to treat it, including a whole care team of nutritionists, psychologists, a whole digital plan which automates the patient follow-up, and putting them into right reimbursement model. So that Fusion Care is launching is enabling kind of a practice enablement for obesity center of excellence and metabolic center of excellence. And then we are working on, from a Valid AI perspective, how do we kind of bring other things together to fruition of shared services in Gen AI in that regard as
That's
well.
awesome. That's awesome. Yeah, I was there at the panel discussions, and listening to the Fusion Care CEO was fantastic on how they are intending to make this change from inside out, as you're describing, is the right way to do it, Ashish. So Ashish, as we come up on the end of the podcast, are there any other plans for the future or any other new things that you are working on, that you would like to share with the audience?
This is good. Thank you. I have devoted, I think, for the next phase to, as I was supporting transformation at scale at UC Davis, to really, I'm taking some time off to support the same journey for multiple health system, health plans, and pharma together.
Great.
All right, bringing things together, kind of expanding from the Valid AI experience into that. And I feel this will be fascinating because can we, through a venture studio or venture accelerator, over next 10 years, touch 1 billion lives? That's the
Right.
goal which I have put. We touched 30 million, 60 million lives in the past one. But how great would that be? As a physician, I would not be able to meaningfully touch more than 10,000 patients in a traditional care I
Yes.
can deliver. But through technology as an enabler, we have a potential to touch masses if we do the things the
Yes.
right way, right?
Very large footprint. Yeah.
Yeah, so I'm looking for very meaningful partnerships with health plans, health systems, and life sciences to co-create entities together. So we don't have to follow someone else leading and disrupting us and creating all those barriers. We can evolve ourselves, kind of a true metamorphosis happens from inside out, you know. So that's what we are on a journey, and we'd love to hear from others, get them as partners, and together we can shape this next phase of our exciting journey.
That is so nice, Ashish. On that beautiful note, I think we will conclude this podcast. And thank you for being here, and looking forward to the next one.
Thank you so much, Rohit.
I'll
Glad.
stop recording and we can chat, Ashish, for a few more minutes.
Thank you.